Okay, good morning, everyone. We are going to go ahead and get started this morning. Thank you so much for joining us today. We hope that you guys are all staying safe and well during this pandemic time, and we hope you and your families are doing well. My name is Ashley Neves, and I'm the Workforce Health Planning Consultant for the Arizona Department of Health Services. Like I mentioned, we appreciate you joining us for today's automated J-1 Visa Waiver Program Application webinar. Today we're going to do a roll call. So Anna, if you want to start us off. Anna, you're on mute.
Sorry about that. Good morning, everyone. My name is Anna Rossetti, and I'm the Workforce Section Manager for the Arizona Department of Health Services, Bureau of Women's and Children's Health.
Patricia?
Good morning. I have a dog here. I'm going to pass. I'm the Bureau Chief for Women and Children's Health. I'll enter my info in the chat.
Thanks, Patricia. Avinash? Okay, it doesn't look like he's on, but Anu?
I'm Anu Anand, QA Supervisor and the Project Manager for this J-1 automation from AZDHS IT.
And then Sophia Horn.
Good morning, Sophia Horn, Assistant Attorney General in the Education and Health section. So acting as an attorney on behalf of the department.
Thank you, everyone, for introducing yourselves. So before we get started, we just want to let you all know that we are recording the webinar. So please make sure that you've muted your lines. We'll be posting this webinar on our website, so you all can have access to that hopefully by next week. Any questions can be asked in the chat box, and we will answer them at the end of the webinar. If we do not have time to answer those questions, or maybe we've run out of time, we'll save the chat box and then reach out to you directly. In addition, we sent out an email on Tuesday to inform all of our stakeholders about the changes and updates we have made to our J-1 website and program requirements. Please make sure you review these documents to understand the changes for the upcoming J-1 visa waiver cycle. Now I'll turn the time over to Annalyn Rossetti to start the presentation.
Thank you, Ashley. Let me pull my slides here. Ashley, can you see my slides?
Yes, ma'am, I can.
Thank you. Okay. Good morning, everyone. Again, Anna Rossetti here with the Arizona Department of Health Services, with the Bureau of Women's and Children's Health. We want to thank you all for joining us and welcome. We are very excited that we're finally here to launch our J-1 Visa Waiver App portal. We are going live with the portal on July 15th, 2020. This is in preparation for the upcoming Fiscal Year 2021 application cycle that will start October 1, 2020 through the end of November. So those of you who attended a webinar back in the fall of 2019, we presented the portal in its early stages of development. And at that time, we gathered some feedback in terms of certain functionalities that you would like to see in the portal. And those feedback were things that we incorporated in the development of the portal. So we're hoping that the portal will be a very user-friendly interface for everyone, and also drive customer satisfaction in submitting an application for the J-1 program. Just a brief overview. Again, we are launching the electronic application cycle for this upcoming application cycle that will start October 1 of 2020. And while AZDHS will start receiving J-1 applications electronically, there will still be hard copy documents that we will require for you to submit by mail, and those documents are or will be mailed to the Department of State. ADHS hopes to, again, enhance customer experience and satisfaction in submitting J-1 waiver application using the portal, in that we are hoping to drive program efficiency in not only managing the applications, but also maintaining provider files throughout the duration of their obligation with the J-1 program. Some benefits in converting to an electronic system. Obviously, we will have improved tracking. The portal is designed to have real-time receipt of applications. In fact, when you submit your application, you will get a notification that the application was successfully submitted. You can track pending and completed applications. In fact, you can start an application, save it, and then complete it at a later date. And those are the pending applications that you will find in your homepage, as well as all of those that have submitted through the portal, either this year or in future years. So you will have a history of all those applications that you've actually submitted in the portal. We will have better tracking of service delivered. This is a future portal enhancement that we're looking into for the next year. Many of our obligated providers in the J-1 program submit their encounter reporting via paper still, and we are looking to convert that to an electronic system. We are also looking to better track changes in service sites and other changes. For example, some of you may have filed a transfer for a particular provider when they're changing from one site to another, or when they're adding sites to their existing approved sites. Right now, those are in paper applications. We are looking to convert this also to an electronic system. In terms of cost and time reduction, we are looking to reduce costs associated with mailing applications, reducing agency costs in storing and archiving applications. We actually are running out of storage. We have a record retention schedule for all of our providers obligated through the workforce programs, including the J-1 program of 6 years. So if you can imagine those paper applications that we have to store, we're looking to really resolve that problem by converting electronically. We want to reduce administrative costs and burden in organizing and reviewing the paper applications, because it's really too cumbersome for us to organize and review the applications. And we're looking to really enhance our process and review the applications more efficiently by converting into this electronic system. Eliminate redundancy and reducing admin burden in manually inputting provider information. So every single provider that gets approved in the program, either through the J-1 program or the other workforce programs that we have, such as the loan repayment program, we actually had to manually enter them into the system. And we have a workforce database. We enter this information that you all provide by paper. So what we're wanting to do is, through a click of a button, and this portal has this functionality, we're able to migrate the data electronically, having to eliminate this process altogether, and reduce admin burden or time in auditing provider files. Right now, we audit our provider files periodically to make sure that we have all the documents needed in order to maintain the file or close the file. And with the portal, we have this, we now have this functionality to generate a report for providers that have not submitted their deliverables or necessary documentation to complete the files. And then improve turnaround time in reviewing the applications, because certainly we will have access to the digital documents, and we do not have to waste so much time in going through paper documentation and look for the things that we're wanting to access. So truly, we're looking to have a shorter time frame in reviewing and notifying our applicants of the outcome of those J-1 waiver applications. Some tips in using the portal: make sure you're familiar with the program requirements for the J-1 program. As Ashley mentioned, on Tuesday, we sent an email out letting you know that there had been some changes to our J-1 program guidance. we actually updated our website to embed all of the resources that we sent you by email. So you will see on the website that there's the documents that we sent you on Tuesday are actually linked to also directly on our website. Make sure you have everything you'll need to complete the online forms. Make sure you have all the supporting documents ready for upload for a seamless application submission process. The portal will accept PDF documents, Word, images, and Excel file, and there's not really a limit on the number of documentation that you'll be able to upload. Supporting documents must have the case number on each page. This is very, very important. So if you're looking right now to submit an application for a J-1 provider, please make sure that the case number is on each page. Pay attention to the prompts. The portal is designed to allow you to double check your work and your documentation. It's not meant to annoy you. There's a lot of prompts in our portal, and that is only our way to help you submit a complete and compliant application. So make sure that the documents that you're submitting have the AZDHS required elements, and you will find when Ashley go through the step-by-step process that on the supporting documents tab, we actually provide so much instruction on what we're looking for in these documents. The portal is designed to help you submit a complete and compliant application, as I mentioned. So again, don't ignore the prompts or the questions. Please read them. Don't just click yes or continue. Make sure that you have the elements that we're asking for in those documentation. Take advantage of the helpful links or help links available throughout the portal. So the portal is designed for you to really help you with anything that you'll have a challenge with. For example, if you're looking to find a health professional shortage area for a facility that you're recruiting for, the link is already there. So it will open a separate window for you to check on that information. If you're looking to complete the census tract information, or maybe you're interested in finding more information of the sliding fee scale, everything is linked for you so that you'll have a better experience in navigating through the portal. And then, of course, if you get stuck and you have any questions related to our program and program requirements, or even navigating the portal, contact us. Ashley and I will be available for further assistance should you need it. And again, updates that Ashley already mentioned, we've updated our program website. We have an application step-by-step guides. The guides are available for employers as well as attorneys. And the guides actually provide print screens of every single section of the portal that you'll be navigating through. So hopefully the guide will really help you navigate through the process of submitting your application electronically successfully. The J-1 program guidance, we have had some changes in certain requirements. For example, our contract guidelines, our recruitment documentation, and some other supporting documentations that we have clarified, because over the years we have gotten feedback from many of you in terms of, you know, our requirements, and some of you indicated that they're not as clear as it should be. So we've made an effort to go through our program guidance and clarify the requirements that people have been confused about over the years. Again, these have been revised, and then we have a new scoring criteria, and this is only going to apply if there's a competition for a waiver slot. And I just want to make sure to acknowledge the members of the primary care office, Patricia Taringo, who's our bureau chief. She's introduced herself earlier. Myself, Ashley, we have a person also who does the designation for health professional shortage area, Tracy Lennartz, and AZDHS IT team who help us develop the portal from start to finish. Avi Nash, he'll probably join us later, and then Anu, who's the QA supervisor. Thank you very much, and I will now turn it over to Ashley.
Thank you, Anna. I will wait until she stops sharing her screen. Perfect. So I'm going to go ahead and share my screen now. Okay, so we will go going to walk through first from this slideshow the login information and creating of an account. So for the primary care office, our website is going to be listed through all of the documents that Anna and I had talked about that we sent out on Tuesday. The link will also be posted on our website. When you click on the link, this is the screen that you will see. It is the ability to log into the provider management system. What I want to talk about is if you do not have an account. Before I talk about not having an account, if you already have an account for the state loan repayment program, do not create another one. We will walk through why further on in the demo because we've merged things a bit so that people don't have to have multiple logins. So when you get on this page and you are a J-1 attorney or a provider or a service site admin for your employer and you need a login, you'll click No Account, Create One. You will be taken to this screen where there are 3 options to choose from. You have providers who can apply for the Arizona State Loan Repayment Program, or if they are a provider who is representing themselves as a J-1 Visa Waiver Program applicant and is submitting an application on behalf of themselves, they have that option as well. The middle item is for attorneys or authorized representatives who will be submitting a J-1 Visa Waiver application on behalf of a J-1 provider. Last but certainly not least are site administrators or employer authorized designees who will be verifying the provider's employment at the service site. This portal will also be used for submitting service and encounter verification reports. Site admins are an essential part of this program because there will be a give and take between the site admins and the actual process that the attorneys or authorized representatives will initiate. And I'll show you that in a little bit. So if a provider is representing themselves for a J-1 Visa Waiver Program, they would click on themselves, and then a second pop-up would occur, and they would select J-1 Visa Waiver Program, and then click Register as a J-1 provider. Now, if you're not a provider, you select the one that most represents you. If you have questions about which one you are, you can always contact us. Once you select an item or a category that you would fall into, you will be taken to this page where you need to enter in your information. The email that you enter will be your login, your username, as well as the email that you will receive any correspondence. So please make sure that you choose an email that you are already using and implementing. And then you'll create a password. Once you create a password, you'll click register. You'll receive this notification saying that we've emailed you an email verification and that you need to go to your email to check that and retrieve that registration email. If you haven't received the confirmation email, give it a couple minutes and check your spam folder. And if by the end of the day you still haven't received it, you can always contact myself or Anna and we can help assist you in that matter. This is what the email will look like. It's very short and sweet. You'll click on the confirm hyperlink and you'll be taken here where it says, thank you for confirming your email. Please click here to log in, which is hyperlinked. You'll be directed back to this screen where you will type in your newly added email and password that you just created, and you'll click log in. When you log in, if you log in as a J-1 attorney or authorized representative, you'll see that this is the home page. But it's marred because there's this pop-up box asking about your company profile information. Would you like to enter it now? If you hit cancel, you can do it at a later time, but I wanted to show you what would happen when you hit yes. This will appear where the J-1 attorney or authorized representative will enter their information, their company information, along with any and all contact information associated with their company. Once they click save, they'll be directed back to the home page. And it'll say save successfully, and then now you'll be redirected to the home page. So I'm going to show you now a live demonstration. Bear with me while I open another tab. It'll just take a second to warm up. Okay, here we go. So let me show you what it looks like when you get to the home page, there's also a forgot password item, so that you can utilize that if you've forgotten your password. If for some reason the link doesn't work, you can always reach out to myself or Anna to reset your password for you. So you see here, after you've done the information, you'll be taken to this homepage. In the top right-hand corner, you'll see you have the ability to change your password, update your profile, update your company profile, and log out. In addition, in the top left-hand corner is this logo called this red logo for the Arizona Department of Health Services. That is your guide to return back to the homepage at any time. You can see here that we are going to be submitting an application on behalf of a J-1 as a J-1 attorney or authorized representative on behalf of a J-1 provider. Click Start a J-1 Visa Waiver Application to start a new application. Please note that when you are logging in as a J-1 attorney or authorized representative, you can submit multiple applications. They're just not for the same person. So if you have 5 interested people who've come to you, you can submit those 5 applications and the system will not log you out or cause any issues. You can see here that the J-1 timeframe will be listed. This currently one is just a testing demo. So in the future, it will say October 1st, 2020, and end date will be November 30th of 2020. This middle section is when the applications are pending to be completed, meaning you have started those applications, but you have not submitted them to the primary care office at the Arizona Department of Health. This bottom section are applications have been submitted for processing and process applications. These are where applications have either been approved, denied, are being reviewed, and things of that nature. And we'll come back to this section once we finish submitting an application. So you can see here that we have an application. It's been pre-filled. You will hit Resume Application. You can see here that there are 3 red tabs. The light pink means that you are currently on that specific tab. Red means that section has been completed. And what you're not seeing here is the bubbles can be gray as well. Gray means that you are starting a brand new application and nothing has ever been entered. So this is the first section, which is the personal discipline section. The J-1 attorney or authorized representative will enter in things like the DOS case number, the date of birth of the provider, their mailing address. We've also been able to, we know that some J-1 providers are not in the United States quite yet, so we've enabled for you to enter any type of address. In addition, you can see a drop-down menu for what type of provider type, what type of discipline, and what specialty as well. In addition, you can select multiple subspecialties by hitting Control and selecting as many subspecialties as you want that represent that specific provider. In addition, languages spoken fluently can be entered here. Simply hitting Tab will allow you to go to the next section and enter as many as you'd like. Now, if we remove this email address and we hit Save and Continue, you will be notified. I know that was just one area where we can show you the warning messages, but if you do not, everything on this page is required. So at any time, if you try to move forward and there's items missing, the system will inform you. So now that we have entered everything in for the personal and discipline section, we'll go ahead and hit Save and Continue. The next tab is the Employer Service Site tab. This is where the J-1 attorney or authorized representative will need to add the employer as well as the sites associated with that employer that the J-1 provider will be working at. Here we'll see that there's the employer name. There is a drop-down menu for you to select the employer. If the employer is not listed, it means that the site has not been registered, and we'll get to that in a little bit. Once you select the employer name, you'll select the employer site admin. That is the person who is going to be verifying and validating the J-1 provider's employment information. Once we select that site administrator, we'll click the sites. These are all the sites that are associated with this employer and this specific employer site admin. So we'll go ahead and add the Arizona Department of Health, and we'll click Add Site. You can see here it's now been added below. We see that ASH has already been added and it's been accepted and complete, which is different than pending and pending you see right here. This is where the service site administrator will have to log into their portal. They've been notified via email that they have to log in and verify and approve the employment for this specific provider. We will show that in just a couple minutes, but I want to finish this off first, and then we'll route back to it. There are 3 options that you can see here. There's a trash can button where you can remove the site, and then we'll go over the review and revert button now, or we'll review those later at a later time. Once you've successfully added all the sites that are going to be associated with that J-1 provider's obligation, you will hit continue. Now you will be directed to the last tab, which is the supporting documents section. As you can see here, it says please address every item on this checklist, and there is a color-coded tab list showing exactly what needs to be completed. Green means that the document has been successfully uploaded. Gray means it's missing, and then yellow means it's deficient, meaning that we've sent the application back and we need you to re-upload a specific document that hasn't been addressed. And we will go over the yellow items later, so I can show you what will happen from the primary care office standpoint, sending back the application. You can see here that this is the first section, and then there's a second section. Now you can see here, this one's grayed out. It's a physician application, but everything else is green, meaning something has been uploaded. This first section, anything that has this little truck next to it, denotes that these have to be mailed to us as well. Not only are you uploading the items in the necessary tabs, but you're also having to mail hard copies with the DOS case number on each page to us at the J-1 Visa Waiver Program at the Area of Health Services. And this is the address that you'll need to send it to. It is most important to note that even when you submit an application, say you submitted it today, and the deadline is, say, August 1st, if we don't have hard copies by August 1st, we cannot take your application into consideration. So please make sure that when you submit these, that you also submit the hard copies in a timely fashion, as it must be postmarked no later than the application due date. So you have 2 options to upload documents. You can either click directly on here, and it'll take you through, or you can click down here where it says upload documents. So we'll go ahead and documents, and you can see here that it lists the name of the provider, the DOS case number, as well as the what section you're on. So you can see here that there are a total of 11 sections, and we're starting on number 1. In addition, you can see that we have the title listed here of the specific document we're looking for, as well as guidances as what exactly is needed to be included. So we can see here that we're wanting you to submit a current edition of the DS3035, including the barcode page, and applications with other versions will be sent back without processing. As Anna mentioned earlier, we have these hyperlinks here that are blue, that when you click on them, they will open a new tab. So this is the website where you would submit the DOS 3035 form. You can see here that we've uploaded about 9 documents. You can see here that these clouds, this means that you have the ability to download a document that you've already uploaded, and it'll appear on the bottom left-hand corner. You can also click the delete or the trash can button, which will delete a file, and you can hit yes or no. And then down here, this section right here is where you can upload documents and save them. So you can either drag and drop, or you can click in the box. So I'll show you what happens when we click in the box. And you can upload as many documents as you'd like. There's no limit, and there's no limit on what type of document it is. So you can see here I've highlighted an Excel spreadsheet, an image, a Word document, as well as a PDF. We'll click open. You can see here that it's been acknowledged, and then it's most important that you click save. If you just hit continue, these items will not appear above. So we'll click save. And you can see here that 4 files have been uploaded successfully. So now we have a total of 12 files. They've also been time and date stamped for your convenience, as well as ours. And then you'll hit continue. Now this is where the pop-ups will occur after each upload section. So for this one, it's asking if the DOS 3035 is current edition, and it doesn't contain the DOS case number on each page. If you select no, you'll be redirected back to the same section, and you will have to remove the correct document and upload the correct document. So we'll go ahead and click yes. You will next be taken to section 2, which is the letter of the organization that wishes to hire the J-1 physician. Again, it'll list all the items that need to be included. You'll see we've uploaded a document already, so we'll go ahead and hit continue. A pop-up will appear asking if the letter has included the verbatim wording, which is listed here. And also, does it contain the DOS case number? This is going to be a running theme. Even though you're uploading documents in an electronic system, both the electronic documents that you upload and the hard copy documents must have the DOS case number on each page. The next section is the signed valid contract of full-time employment. From the time USC grants a waiver of the 2-year home country residency requirements. This is a section that we have recently revamped. You can see here, this is all the information that is going to be required, and we've also hyperlinked to the contract guidelines. The contract guidelines have been revised, and we've actually taken out the termination for cause item in here, which I'm sure most of you are familiar with, so we've removed that. But you can jump to this contract guidelines at any time to make sure that the contract that you receive from the employer on behalf of the J-1 provider meets these requirements. So once that's been completed, you'll upload a document and you'll click continue. Again, it'll ask if the contract contains the required provisions per the contract guideline document I just showed you, as well as the DOS case number on each page. We'll hit yes. The fourth section is the legible copies of the physician's IAP 66 or DS 2019 forms covering every period the physician was in J-1 status. Again, we've asked what needs to be included, as well as for this item only, we've specifically asked that it be in PDF format and that it has the following naming convention. Once it's uploaded and saved, we'll go ahead and hit continue. It'll ask if the forms are legible, covers the period the physician was in J-1 status, and contains the DOS case number on each page. We'll click yes. The fifth section is going to be the curriculum vitae or resume. It needs to be up to date, and it must have the DOS case number on each page. We'll see here that we've already uploaded a document, so we'll click continue. Again, the pop-up will ask to ensure that the document that you've uploaded is current and up to date and contains the DOS case number on each page. The sixth section is the Form G28 or letter from authorized representative. You'll see here we've already attached a document, we've already saved it, and we'll click continue. It'll ask if the documents are signed and contains the DOS case number on each page. We'll click yes. The seventh section is the J-1's proposed responsibilities and schedule. You'll see that we list what the document must contain. After you've uploaded the document and click saved, you'll hit continue. And it'll ask if the upload description of the J-1 Visa Waivers proposed responsibilities and schedule contains the required elements as described and contains the DOS case number on each page. We'll click yes. The next section is the unsuccessful recruitment efforts for the past 6 months. This section is something that we've heavily revised as well, of the do's and don'ts of what we are looking for. So this section has more pop-ups than any of the other sections because we want to make sure that this recruitment section has been filled out correctly on the first try, so there's not this back and forth that we've previously had. You can see here we've included that there must be a narrative description and what the narrative description must have in it, as well as it's made a good faith effort to prioritize and recruit a qualified physician. And then it must provide evidence of active and ongoing recruitment at least 6 months prior. In addition, we've hyperlinked here the J-1 guidance that has been newly redone. And if you scroll down to the requirements section, which is located on page 7, if you scroll down further to the recruitment documentation, this will list exactly what is needed in the narrative, as well as what dated recruitment documentation we accept and what dated recruitment documentation we do not accept. So it's vital that you go through this, as Anna has newly revised this. It is on our website as well as hyperlinked in our portal. Again, you can upload as many documents as you want. You'll click save and we'll click continue. So this, like I mentioned earlier, this is where we'll get multiple pop-up boxes. So it'll ask if the uploaded recruitment efforts are dated. We'll click yes. Are the documents specific to the J-1 visas, J-1 physician's position? We'll click yes. Do the documents demonstrate active and ongoing recruitment for at least 6 months prior to the submission due date of the application? We'll click yes. At any time, if you click no, you'll be directed back to this page and you'll have to re-upload your documents and then continue again. So then it asks if you uploaded a copy of the narrative describing the employer's recruitment efforts. We'll click yes. And then again, does it contain the DOS case number on each page of the documents you've uploaded? The next section is section 9. This is a physician application. You'll download the physician application, but you'll see here that the employment verification process has not been completed and to please follow up with the site administrator. So this goes back to the employer service site where it shows that it's been pending. So the system is basically telling you that it can't complete the physician application section until this has been addressed. So we'll go back to the supporting documents section and go forth on where we left off. We'll leave this for later. We'll go to the 3 letters of community support, which is section 10. This is also a newly revised section where we have decided that you no longer need to send the originals to us hard copy. You will merely need to upload them in the system. So we've uploaded the document. We'll hit continue. And we have to make sure that those community letters of support on company letterhead are signed and are not from members of or affiliates of the sponsoring organization or service site, and they must contain the DOS case number on each page. So we'll click yes. We'll be directed to the last section, which is section 11, which is the copy of the physician's license or license application. Again, this section has also been revised. We have noted it here in lieu of an Arizona medical license, a receipt or email confirmation of the Arizona medical license application filing from the Arizona Medical Board may be submitted. So that's something we've revamped as well. So we'll accept a couple different items rather than just the medical license or the medical license application. In addition, we've listed the Arizona Medical Board phone number and website, just in case you need to get a hold of them. Once you've uploaded your document and saved it, you'll click Continue to Document Checklist. It'll then have a pop-up that says, do the uploaded documents have the DOS case number on each page? We'll click Yes. Now, since there's still a deficient item here, you cannot submit your application. You see down here, there's no option to submit, which goes back to the fact here under the employer service site that the items are still pending. So what I'm going to do is I'm going to log out as a J-1 attorney or authorized representative, and I'm going to log in as a site administrator. Now, site administrators are from the employer who will be verifying the employment of the J-1 provider. We have a couple of our service site admins who are on the call today, who are site admins for the state loan repayment program. This is a separate program that we have. But basically it's going to come to play with the employment verification as well as the encounter notes. So you can see here that we have 6 bubbles. Step 1 will be entering employer information. Step 2 will be adding all of the sites that you are going to want to be activated to be utilized by either program, the SLRP or J-1 program. You'll see here that pending approval and incomplete applications we'll discuss in a second. This is where all complete applications will live. And then this one right here is the encounter information where you will submit encounter reports, which will come, as Anna mentioned, at a later date. So when the service site admin logs in, they'll click step 1 and they will fill out the employer information. They'll fill out if it's a nonprofit, for-profit, or public or private, and we'll click submit. It says that you'll automatically be generated to step 2, but at any time you can use the home button to go back, and you can click step 2 to go back. So for the service site admins who are currently on the line, you can see here that you now have a tab where you can click SLRP sites or J-1 sites. So you can see here that we don't have any SLRP sites registered. And then here we have 3 J-1 sites registered. And the reason we divvied them out is that not all SLRP sites will be eligible or be deemed J-1 sites and vice versa. So it's important that if you list J-1 sites here, that if those sites are also going to be utilized for SLRP sites, that you list them here, because they are 2 separate applications. They will pull 2 separate lists. So if your sites are not registered as SLRP but are registered as J-1, then they will only pull up for when someone submits a J-1 application and vice versa. You can add as many sites as you want by clicking Add New Site. You can have a search functionality here, and it also lists all the sites listed. It is most important that you look down here to see that they are listed as active. If they're listed as inactive, it means that you have not successfully completed the registration process for those sites and that you need to go back and address them. So I just want to click on one site to show you what it looks like. For a J-1 application, it's a shortened process. You'll fill out the demographic information, when it was in operation, what type of practice site it is, the nearest sliding fees clinic, and you'll click on this website to find that information. In addition, you will fill out the HPSA information or the MUA information. It's purely up to you which you supply, but you have to supply one or the other. We've also listed help information here where it'll generate you to the actual website where you could find this information. And then you'll enter the last 2 calendar years of data. If for some reason your service site has not been operational for 2 years, we have allowed you to, you'll enter zeros, but we'll have you enter the description as to why. Maybe it's only been open for 7 months and you just would need to let us know there. Once you click save, it'll let you know that the application, maybe, let's see. It'll let you know the data has been saved and you'll be redirected to the home page. So these are all that are associated with our J1 for J1 for the specific employer. So then step 3, when the J1 attorney or authorized representative added that site that I showed you previously, the service site administrator got a email letting them know they had to go into the portal and complete step 3 and step 4, which is the employment verification and validation process. So we can see here that there's 1 in queue for pending site verification. So we'll click step 3, and you can see here this is the exact provider that we submitted, and you have the option to approve or reject. Reject basically means that you have no idea who this provider is, maybe their site to their application, but we've given you that option. When you check the checkbox and you hit approve, you're basically saying, yes, I approve this request, and that you're acknowledging that this person is in fact working for you. So we'll hit yes, approve. It'll say that the authorized attorney or representative have been notified that you've completed this first step. And then when you scroll down here, you can see that there's 2 tabs. There's an accepted request tab and then a rejected request tab. It'll list all of the employers that you've previously approved. So you can see here, ours populates down here. And then when you float to the rejected tabs, this will list all the rejected requests. We haven't rejected anything, so nothing will appear. Now, like I mentioned, this is a 2-step process. So you can see here when you click on this logo and go back to the home page, you can see here that it's zeroed out, meaning we've completed this step and now we need to go to step 4. You must complete both of them. So step 4 is the verification of additional provider eligibility. You'll see here incomplete request, and I'll say incomplete here. You'll click on the provider's name, and you'll be directed to the next page where it'll list the provider name, the site name that they're wanting to get added to their application, the address, as well as the program type, which is J-1 Visa Waiver. You'll enter the provider's anticipated start date of service. Now, I understand people are leery of this, and because basically the application is dependent upon the state recommending a J-1 Visa Waiver, as well as USCIS then granting it. Like it says in the thing, it's just an anticipated start date, and we're not going to hold you to the start date. So let's say the provider is going to be starting on October 1st of 2020. Now, for the J-1 Visa Waiver program, the J-1 provider has to be working for a minimum of 3 years. So we'll enter the end date here. Again, this is tentative. Now, I only added the date for 1 year after because I want to show you the error message that will pop up because it's not for 3 years. This question will ask if the provider is serving in an inpatient, is providing inpatient services in a hospital or works in a state or federal prison. You'll just click yes or no. And then once you've completed, you'll click save. Now, like I said, an error message will occur because it recognizes that the end date is not greater than 3 years. So we'll go ahead and change this to 2023. And we'll be able to save it. You'll now be redirected to this section where you will be uploading all the necessary documents, including sliding fee scale and evidence of HPSA or MUA. The first document that needs to be addressed is the service site employer application. You will download the document, and it'll download right here. You'll click on it, and everything is being pre-filled, including the DOS case number. The DOS case number will appear on each section of the pages. And as you can see, anything that you've registered the site as will automatically appear here, including service dates that you entered, your employer name that you entered, what type of employer, the last two data tables, and then last but not least, the fourth page is the most important page. You need to get this signed and you need to get it notarized. Once it's signed and notarized, you will re-upload that back into the system. And we'll go ahead and upload a document here. And we'll click Save. It'll let you know the file was successfully submitted. And then we'll hit Continue. It'll ask if the DOS case number is on each page, as well as if it's signed and notarized. We'll click Yes. And you'll be directed to the second section, which is the sliding fee scale policy and procedure document. The sliding fee scale policy sample we've included here as a hyperlink, merely as an example for you to view, to see exactly what we're looking for. You will upload this document. It is important that this document has the DOS case number for this specific provider, and you can see here that the DOS case number is listed for you for your convenience. So prior to uploading this document, make sure that each page of the document has this number on it. We'll click Save, and we'll click Continue. It'll ask if the DOS case number is on each page. We'll click Yes. The next is a sliding fee scale data table. It must be based on federal poverty level guidelines, and it must be for those who are uninsured or at or below 200% of current federal poverty level guidelines. We've included the link for the federal poverty guidelines here. When you click on it, it'll take you directly to the most current poverty guidelines, so it takes you directly to the 2020 guidelines. Once you've gotten that table and made sure it's up to date, you'll click here and click Save, and you'll click Continue. It'll ask if the DOS case number is on each page. We'll click Yes. You'll be directed to the fourth section, which is the sliding fee scale signage. We've also included a sample link here of exactly what we were requiring in that. We're requiring that it be on company letterhead and that it has the provision of health services, of the services regardless of ability to pay. We'll go ahead and upload a document here. And we'll hit Continue. And the pop-up or warning message that appears is asking to make sure that the DOS case number is on each page. We'll click Yes. And in addition, it'll ask to make sure that the sliding fee scale signage does not discriminate based on the provision of health services regardless of ability to pay. So we'll click Yes. And last but certainly not least, the last document, we will upload the evidence of a health professional shortage area or medically underserved area or population. We've included the link here for your convenience where you can run this information. Once the information has been run by you, you'll upload it. Please make sure that the document has a DOS case number on each page. And once you've uploaded it, you will have a button appear here saying Submit Employment Application, or excuse me, Submit Employment Verification. It'll ask, are you sure you want to submit the employment verification? Once submitted, you may not view or make any changes. If you hit cancel, you can go through and double check your work, or you can click Yes. It'll say you've successfully submitted your employment verification to the attorney/authorized representative or J-1 provider to continue their J-1 application submission, and you'll be redirected to the home page. So we'll click OK. So you can see here, these are both zeroed out, and then complete applications here went from 8 to 9. We'll click Step 5. There's nothing that you need to do in Step 5. This is merely an item to see all of the completed requests that you've successfully submitted. You can see here that you have the ability to download the documents that you've uploaded. So any documents that you've uploaded will appear here, and they're not just going to be gone. So you can see here all the documents are going to be listed here by the different categories. And then Step 6 is the encounter reports, which we will go over hopefully next year once it's built. So we'll log out as a site administrator, and we'll log back in as a J-1 attorney or authorized representative. And again, once the site admin has completed their section, an email has been generated to the J-1 attorney/authorized representative, letting them know that they've completed their piece. So we'll click Resume Application. We'll go to the Employer Service Site tab, and you can see here that the Department of Health Services has been accepted as well as complete. Now, again, like I mentioned earlier, you have 3 options. You can either review the documents, revert, or delete. Delete means you're deleting the site. Maybe it was accidentally entered, or maybe the terms of the negotiation of the contract have changed of where the provider will be serving. Review means that the J-1 attorney or authorized representative can actually view the documents that the service site administrator uploaded. So we'll click, and it'll be the same thing. So they can go through to have another layer of looking at the documents to make sure that they are uploaded, that they're the correct document, and that the DOS case number is on each page. Now, let's say as a J-1 attorney or authorized representative, we've looked, we've reviewed these documents, and we noted that for some reason, the HPSA document is unreadable, is illegible, and does not have the DOS case number. That's where this revert button comes into play. The revert button lets the attorney or authorized representative send that application back to the site admin to address the issue prior to submitting it to us at the primary care office. So when you click revert, it'll ask, are you sure you want to send it back to the site administrator to complete, to recomplete the employment verification. And you can type any notes to the site administrator here. So we can say HPSA/MUA/key information. It is important that you list notes here, because once you click yes, an email will be generated to the service site administrator letting them know that the employment verification was sent back. And in that email, it'll list the note section. So we'll go ahead and click yes. And it'll say that it's been returned. And we'll click OK. And you can see here that it's been sent pending status. So what I'm going to do is I'm going to log out and show you from a service site administrator point of view. You can see that it populated from 9 back to 8 because it was reverted right here. So you don't have to do step 3 again, but the employment validation you have to do again. So we'll click step 4. We'll click on the provider again. It'll already be pre-filled, and you need to make the necessary changes that were noted by the attorney or authorized representative. So we'll click save. And like I mentioned, the issue was with the HPSA. So we will go through and hit continue and click through all of this to get to the HPSA section. We will delete the incorrect document and go ahead and re-upload a new document and click save. Once the service site administrator is sure that they have changed all the necessary items that the attorney has or authorized representative have identified, you can resubmit it by clicking here. It'll say if you're sure you want to submit, and we'll click yes. Again, it'll say that it's been the application was submitted back to the attorney or authorized representative or J-1 provider, and they have been notified by email that you've done so. So we'll click OK. And again, now you can see it's here in this completed application state. So we'll log out and log back in as a J-1 attorney or authorized representative. We'll resume the application. We'll go back to employer service site, and let's say that we've reviewed the uploaded documents. Everything's good to go. So we want to submit the application to the primary care office for review. But if you remember, we still have this grayed out application right here, physician application. So we'll click that, and we'll download the physician application. It will be pre-filled. It'll include all the demographic information you had entered, what type of provider they are, their subspecialties, the service sites that they will be working at. And as you've noted, the DOS case number is pre-filled on each page of the document. It is important that the J-1 provider sign page 3 and page 4, and both of their signatures must be notarized. After the items have been signed and notarized, you will upload this here, and you'll click save. And we'll hit back to document checklist since we've already uploaded all the other additional documents. So the pop-up has occurred to show you that to ensure that the DOS case number is on each page. We'll click yes. And now you can see here that everything is green. And now you can see that we're given 4 separate options to choose from. You can go to previous tabs, upload documents to upload any more or additional documents that you need. You can submit the J-1 application, as well as you can download the mailing instructions. And when we click download mailing instructions, there's a little PDF, and this will list all of the hard copies that the Arizona Department of Health Services is requesting as and the address that they need to be mailed to. Again, it must be postmarked no later than the application due date. So let's say you've reviewed the mailing instructions, you can click Submit J-1 Application. It'll ask if you haven't already downloaded the mailing instructions for sending the original copies of the first 7 documents, please download now. So you can click download and it'll re-download those mailing instructions for you to view. So let's say we've already submitted everything, those hard copy documents, we'll hit continue. It'll ask, are you sure? Because you will not be able to make any changes. We'll click yes. And it'll say the application will not be considered for a J-1 visa waiver until AZDHS receives the hard copies postmarked no later than the submission due date. So we'll click I agree, and you'll be redirected back to the home page. You'll see we have no pending applications in queue to submit, but you can see down here that we've submitted Dr. Johnson's application to the primary care office, and that it's in this processing state. So I want to show what happens on the primary care office end when we review the documents. We have the ability to enter what is called a notice of deficiency. These notice of deficiencies, basically we've reviewed the application here, and we've noticed that there are some items missing, or maybe the DOS case number is missing, or maybe we need clarification. This is where we would go, Anna or myself, to review those documents and to issue any types of notice of deficiencies. Now, the nice thing about this system is we will enter the docs received. This is meaning that we have received your hard copies that you've submitted on behalf of the provider. So let's say we receive that the documents were postmarked July 2nd of 2020, and we received them today, 7/10/2020, and we'll click Save. This will then cause an email to go to the J-1 attorney or authorized provider or authorized representative stating that we have received those documents. And it'll provide the dates that we received them. So we are going to go ahead and process this. Let's say Anna and I have reviewed this application. We noticed that the case number is not on each page of the DOS 3035. So we'll click Submit. We'll submit the deficiency. We'll click Submit. And then we've also noticed that there's a site admin deficiency, meaning one of the documents, even though it's been reviewed by the attorney, is not the correct document. So we can also add a site admin deficiency. So we'll click a site and we'll say that the case number was not, let's see. We'll say that the proof of HPSA is unreadable or unclear. And we can add notes here. We can hit save. And then we'll send a notice. So this notice, an email will be initiated by the system and will be sent directly to the site admin to address this. Now, for the notice of deficiency that was issued to the J-1 attorney or authorized representative about the DS 3035, they too will get their own separate email to address those issues. So this is what I want to show you. Let's log out and we'll log back in as a J-1 attorney or authorized representative. We can see here the same application has occurred here, and that there are view deficiencies and resubmit, or you can request for an extension. Let's say you click view deficiencies and resubmit. This will automatically pop up and list exactly what we are looking for. The case not on each page of the DS 3035. Now, hypothetically, let's say that the list is much longer, or maybe there's some back and forth that as an attorney or representative you have to do with the employer, and maybe you need more time to address these deficiencies. You can click request for an extension. You can do 5 business days, 7 business days, or 10 business days. Once you select that option, me and Anna at the primary care office will be notified, and we will either approve or reject your request. If we approve or reject your request, you will get an email stating our decision. If we approve it, it will provide you in that email with the updated date, the updated due date. So we'll see here that we need to address the case numbers not on each page of the DS 3035. So we'll go to the supporting document section. And we can see here that now this document is yellow, but everything else is green. And that is because the primary care office has flagged this as being deficient. It'll be yellow. So we'll go ahead and click on this. You'll need to re-upload the DS 3035 as well as mail this new form again, because we have to have the hard copy of this form. We'll click Save. And then we'll go back to the checklist. It'll walk you through those pop-ups again. And then we'll see that it's turned green. Now we want to resubmit the application, but it says you will not be able to proceed past this point until after the site admin completes the application verification process successfully. Now the attorney or representative may not know exactly what that means, so we'll query to the employer service site. And we'll see that this site of ASH, the Arizona State Hospital, was sent back as pending, meaning that the primary care office noted that something was wrong or off, or there's an incorrect document that's been uploaded, and it was sent back to the site admin to advise on and to resubmit. So we cannot resubmit the application until the service site administrator has done their piece, and they were notified in an email to do that, to log in. So let's go ahead and address that deficiency. You can see here it's again reverted back to step 4, and it'll look a little different. We'll see the view deficiency. It'll note that you need to complete the deficiency as soon as possible because the J-1 attorney or representative is unable to resubmit the application. It'll list the notes. Whoops, sorry. It'll list the notes here, and it'll list the documents that are needed. So you'll click on the name. We'll click Save. And we'll address any of the deficiencies that were listed, which again was the HPSA. So we'll go through until we get to the HPSA section. And we will go ahead and re-upload the document. Or whatever needs to be done to the document, do so and then re-upload it. And then delete any incorrect information. You'll submit employment verification. It'll ask, are you sure? We'll click yes. And I'll say that it's been successfully submitted and the attorney or representative will be notified via email that it was completed. So we'll click OK. We are going to log out, and I'm going to show you how to resubmit the J-1 provider application. We'll go View Deficiencies and Resubmit. We can see here under the Employer Service Site tab that this has now been completed. As an attorney or representative, you still have the option to review and revert, or excuse me, you can have the option to review the documents. If they are still incorrect, instead of resubmitting it, you can revert it back to the service site administrator and do this, and they'll do the same process as I showed you previously. So for the purposes of this, say everything is good to go. We've addressed the resubmission. We've mailed that new hard copy. We'll click Resubmit Application. It'll ask if you're sure you want to resubmit. And then I'll provide you the opportunity to enter in any notes that you want the primary care office, me and Annex, to know. Let's say uploaded documents. And you can click yes. Now it's saying you've successfully resubmitted your application and you'll be directed to the home page. So it's again back in that processing status. So I'm going to log out and I'm going to show you what Anna and I see when we process, and I'll walk you through some really cool features that allow us to be pretty paperless with this system. So you can see here it was resubmitted. So Anna and I will review the documents, and let's say that we've reviewed everything, we've reviewed your resubmission notes, and we've decided that everything's complete. So we mark it as complete, and the J-1 attorney or the representative will be notified during this whole process. Every time we approve it or recommend it or anything like that, you'll receive an email. So we'll recommend the application be sent to USCIS, and we'll say the application is sent to USCIS. So this means that Anna or myself have submitted those 7 hard copy items directly to USCIS. So one of the cool features is that Anna and I have the option to click Shift to USCIS, and we will enter the tracking number and the shipping date that we sent those 7 documents. And when we click Save, the J-1 attorney will be notified. You will be able to actually log in. Let me log out really quick. Whoops, my apologies. Bear with me 1 second. You will be able to log in to the portal as a J-1 attorney. and view the tracking. So you can see here it's processing, and you can view the tracking on exactly what we entered. That way it puts more of the functionality back in your own hands so that you're not having to email us, and you have all the information needed on right here on this screen. Okay, so let me go back really quick. Now, let's say that USCIS has granted the waiver. The state will receive that letter, and we will process, and let's say they approved the application. We will upload that letter that we received, which will then be saved in our system, but also you will have it on your end as well. And we'll click submit. So we've gone through the entire life cycle. USCIS has granted that waiver. The J-1 attorney or authorized representative will be notified of that, saying that it was granted. So we'll log in as them really quickly, because there's still some additional items that the J-1 attorney or authorized representative will need to enter. You can see here that the status has changed to USCIS granted. You can click on download USCIS documents. This is the letter that we've uploaded for you, so it's always in the system. We know that USCIS sends you a copy, but we also wanted you to have it in the system. Now, there's this new provider info tab. This is the information that I typically send to all the attorneys or representatives. I ask for 4 things. I ask for the start date that the provider has started with the employer, their new address, their H-1B approval, as well as their actual physician licensure. And that's different than, say, if you provide the application or the receipt. We're looking for the actual medical license now. So the attorney or authorized representative will click view provider information, and they will enter the start date, the residence address, they'll upload the H-1B, and they will upload the medical license. Anything that you upload can then be retrieved, and you can re-download it if you'd like, and it's saved in the system. Once all of this has been saved, the primary care office will be notified that you've submitted everything, and we will then enter that into our system. Now, let's say that hypothetically that the start date has changed, or some issues occurred, or they changed their address halfway between their obligation. You can always notify us via email, and we can change that on our end. So we'll click back to home. And that is the entire life cycle of submitting a J-1 application. I know that we went over a ton of information, but these will be saved, like Anna had mentioned, so you can see that this was the year you submitted, this was the provider name, this is the status of it, and all the documents will be saved and will be provided for this application. So now we're going to turn the time over to you guys. I'll stop sharing my screen. And basically, it's your time to ask any questions that you may have. You can enter them into the chat box, or you can unmute your line. One thing I want to mention before we take questions is that, like Anna mentioned, this is going to be going live on the 15th. That is when service sites and employers can register their sites. The application system will go live, but J-1 attorneys or authorized representatives will not be able to enter an application until that October 1st. If you try or attempt to submit one or create one, it'll tell you that the cycle is not open yet. So like I said, we'll turn the time over to you guys. If you have any questions, comments, you can unmute your line or type them in the chat box. Anna, did you want to mention anything else?
Nope, I'm good. Thank you.
Okay. There's no questions in the chat box. If you're shy, you can always email me or Anna directly. As Anna mentioned at the start, there are several guidances that we've already posted to our website and we emailed to you on Tuesday about the program. Those are going to be vital and helpful in you submitting an application as well as registering the sites. They're great tools. And then also too, you have Anna and I as a tool as well that we can assist you with. So there is a question in the chat box. Her name is Hannah Kim, and she's an immigration attorney in Nashville, Tennessee. She says, I have a question about the deadline extension. If we get approved for an extension, but the site admin requires longer than the deadline, will that be all right? Yes, so you will just, let's say that you've asked for an extension of 10 business days, and you're on day 9 of that extension and the site admin still requires longer, go in and ask for a second, ask for a second extension. That way they have the ability to address their needs, and it's not going to put the application, so the application is not sitting there and we don't know what's going on. So you can ask for multiple extensions.
Ashley, I want to add that I think the idea here is that the attorney has access to the portal and they can see if the site administrator has addressed any deficiencies, because otherwise it will show as pending. So just make sure that you're working with the site administrator closely in any kind of documentation that's needed in order to submit the application by the due date. But as Ashley mentioned, if you need more time, of course, you can submit an extension request and we will consider those requests as needed. Thank you.
Like I had mentioned earlier, and Anna had mentioned earlier, there is this give and take between the two systems of the site administrator as well as the attorney or authorized representative portal. So it's very important that you are able to identify that person. You work with the employer to make sure that they've identified a person so that you guys can communicate back and forth to make sure that the necessary items have been uploaded and completed. That's also why we've given you that review and revert button, so that you can review the documents before you submit or resubmit the application. Are there any other questions? Okay, well, there's nothing in the chat box. But we wanted to thank you so much for attending our webinar. We are really excited about this J-1 application process opening up next week on the 15th. Like I mentioned, if you have any questions or concerns or comments, you can always reach myself or Anna about this process, and we can help you in any way possible. But thank you so much for attending, and we hope you guys have a good rest of your Friday and a good weekend. Thank you so much for joining us today.
Thank you.